Yep, so that's the first thing I always start out with. So thank you for joining tonight again, everyone, for the Tuttle Talk. I'm Megan Tuttle, president for NEA New Hampshire. We are recording the meeting tonight, as we always do, and you can go back to the website to see any of the recordings from past Tuttle Talks that we've had. So this week and next week, we're going to really talk about reopening of schools and what it could look like. And so instead of kind of just doing it in 1 week, I thought, this is such an important topic. It's big. We're gonna look at it in two different ways. So this week, we have Mark Jewell with us, who is the president of North Carolina Education Association. And they apparently have all the bad weather down there. So we're gonna leave it down there with them, and we'll keep the nice weather here. But I've been serving with Mark for, I think, 4 years now in this role. And it's been a journey. I can say that. It's been a journey. He came in around the same time I did, has been involved with leadership. And it's always interesting to hear different perspectives of what's going on in different states. And so we have a President's Face group chat or Facebook page, I guess, group that we're all on. And throughout, the week, we get different things. So you guys know that I'm on the task force for New Hampshire's reopening of schools. And it's really kind of not going anywhere. The survey went out, right? That had about 50,000 people respond, or 50,000 responses. But we know a lot of those responses were emotion, because you're asking parents how they felt about the end of the year. You asked educators how they felt. Some students answered it. And I think there was a lot more emotion in it than anything. And I don't think that it was really driven by data and by science. And that's what we know we need to reopen schools. One of the documents that they sent, because we know the commissioner in New Hampshire is not good on giving guidance when it's needed. He gives it 3 weeks too late. One of the documents that they sent is this Strong Schools North Carolina Public Health Toolkit. And so I think everybody that signed up for tonight got a link to this. If you didn't, we're going to have it posted on our website. This is what North Carolina is looking at to reopen. It's in the chat
box now, too.
It's in the chat box. Thank you. I just need to say this. I was on a call right before this one with the NEA think tank on reopening schools. And there were 5 kind of broad themes that we were looking at. And those themes were future forward for teaching and learning, looking at like reimagining education, the next generation, things like that. Strengthening, leveraging the traditional unionism, technology opportunities and concerns. And that was something that I brought a lot up about because of using your own Wi-Fi and privacy and the code of conduct and everything like that. Health and wellness and safety, race, social justice, class equity, and then the fights that we have as we get into this, looking at privatization, bad actors who think they know about public education, like our commissioner and our National Secretary of Education. But when I looked through the North Carolina one, there were some things I thought in there that were really interesting. And I don't know what the New Hampshire Task Force is going to get out of it. So I wanted to look a little bit at that tonight and talk to Mark about it. But I just want to let you know, next week, we're going to take a really deep dive into an internal document from NEA. So internal meaning we can share it with leaders, we can share it with members, we just don't want to share it with superintendents and things like that. That's really the guidance to state and local associations on reopening schools. And this came from General Counsel at NEA. So we're going to have Donna Harris-Aikens with us next week, who's a policy director for NEA. And the NEA Collective Bargaining and Member Advocacy Department. So we'll get this out to everybody. It's like a 30-some odd page document. It has some really great things in it. But anyway, this will go into that. So a couple things I wanted to highlight in North Carolina's, and then I'll turn it over to Mark. One thing we kept talking about today that I think is going to be a kind of key feature for us going forward is risk tolerance. Because nobody is ever going to say it's completely open or it's completely safe to reopen our schools. Nobody wants to take that chance. Health and Human Services doesn't want to say it. The commissioner doesn't want to say it. The governor's not going to say it. You know, so what is our risk tolerance really? What can we tolerate for reopening of schools or not? We know that there's this anxiety. As educators, I know that school just ended. How many of you like to plan? I mean, how many of you close your classrooms or close work, right? I see Beth, yep. And you are already thinking about next year, how are you gonna reopen school and what are you gonna do? Sadly, we don't know, right? We know that we're gonna be teaching and we'll be working in schools, but we don't know if it's from home. We don't know if it's from in classroom. We don't know if it's wearing a mask. We don't know if it's wearing a face shield. We don't know any of that. And that's really anxiety producing for us as educators. It would be nice for somebody to say, you know, wave the magic wand and the risk is so low, we're all going to go back. We can't do that. Now, we're going to be the ones that are standing up for the educators because a lot of the other groups are not doing anything. It falls back on NEA New Hampshire and NEA. But what I thought was really interesting in North Carolina's document is they have required versus recommended. And it's really clear cut as to, you know, schools are required to do this, but they're recommended to do that. And I really liked it when I was looking through it. They actually are requiring their schools, and I'll let Mark touch on this too, but you know, they have to have 3 different plans. They have to have plan A for minimum social distancing. They have to have plan B for moderate social distancing and plan C for remote learning only. I mean, this is, you know, this is just, I really like this. One of the other things, and then I'll turn it over, that I kind of highlighted as I went through it, where is it? At the end, there was a checklist and it had additional considerations. It's recommended that schools designate a single staff member to be the COVID-19 point of contact for the school in collaboration with district school nurses. So this is taking that emergency team that we should all be having, but making sure that there's one designated just for COVID-19. And then there was, you know, at the end, there were some checklists on things that, you know, you had to do before you could go in. This was developed much different than we develop things in New Hampshire. They have a superintendent that likes them and works with them. So I'm going to turn it over to Mark to talk a little bit about that. As you're talking, Mark, I'm just going to kind of go through some of the chat, and what we do is we just kind of, we'll bring things up after. And I mean, you and I could talk all night, so this could be bad.
Yes, I know. We just, well, first of all, thank you, Megan. I love the name, Tuttle Talks. So is this a weekly call?
It is. It's every Tuesday at 7:30.
And is it local leaders?
It's anybody. We open it up to all the members, and they just have to register. And I see a lot of the same people, which is great because we're going to tap into them for advocacy. But it's great because if, you know, they have questions, they have comments, they have things that we don't know about, and so we save the group chats afterwards, so we can always get back to people if we need to. But anybody can come to them. And what I started doing was inviting other presidents, people from NEA, other experts in the field, so they can really just talk to our members. It's live every week. Never know, you know, usually my kids are popping through the background, getting pudding, getting chocolate pudding all over their face. My dog likes to join in. It's pretty casual.
I love it. I love the name. I thank you, George, for hooking me up on the link today. And hello, NEA New Hampshire. Greetings from North Carolina, where the skies are not always Carolina blue. We have a system that has stalled out on us this week, which is not helping as we're in the 3rd month of quarantine here, as we all have been. But it's good to see you all and to be with my NEA family and with Megan and George and all of you all here. It is, yeah, we're going through the same challenges that you all right now. Our schools are just wrapping up for the school year. Teachers' last day, you know, was today, yes, you know, and yesterday, last week. After 3 months of distance learning, like most of us have been on. We had, give you a little bit about our statistics here in North Carolina. We are the 9th largest school system in the country. We have around 1.5 million public school students, about 110,000 school employees. Our stats as of today, we have 44,119 confirmed cases. 23,653 have recovered, and 1,109 deaths. We are in phase 2, which is what our governor calls safer at home, which has released some of the restrictions and opened up some restaurants for capped dining and social distancing, still continuing. And since that has happened over the past 3 to 4 weeks, our numbers have increased. If you've been following the news, we're one of the highest increases of cases, and not only with diagnosis of coronavirus, but also with hospitalizations. So according to our governor, he could put us back on phase 1 if this continues. This is what we've been hearing from health experts, right? This is what is going to happen. This isn't phase 2, right? This is just getting up to, not even to the middle of the original pandemic here. And as we continue to waffle back and forth between phase 1 and phase 2, we're going to see spiking of cases, we believe. We do have, one of the things working in our favor is we have a governor who follows the advice of the science and health experts, and believes that all of his decisions should be made on the best interest of the health of North Carolinians. So we were one of the last states to slowly reopen. But as I told you, our numbers were going in the wrong direction since we've done that. So where do we go for our schools right now? This is what everybody's asking. The State Board of Education in North Carolina is appointed. They are political appointments, and most of the board now is appointed by our governor, who is a strong supporter of public education. He's been in the office for 4 years. He's up for re-election. Prior to that, we had an anti-public education governor who was supportive of privatization and profiteering. And we had a state school board superintendent who was elected also, Mark Johnson, who is also a reformer and supporter of vouchers and for-profit charter schools. But to our advantage here is that the State Board of Education is really is in the power right now, and are making the decisions despite our state superintendent, who is elected. He decided not to run for re-election and run for lieutenant governor. Well, he finished, I think, like 3rd out of 4, so he's not going to be back. And we hope to elect an NCAE member in the general election as our state superintendent. But the governor listed some general guidance a couple of weeks ago on his viewpoint, followed by our DHHS, the Department of Health and Human Services, and the CDC. With the State Board of Education came out with specific guidelines last week, which, as Megan told you, gives us 3 different scenarios on what opening of school could look like. Plan A is minimal social distancing. You can imagine what I thought when I first opened up the file. Yes, I got angry. And I said, will be implemented assuming that COVID-19 metrics continue to stabilize and move in a positive direction. And if you read that, and if you go through and read what some of the specifics of minimal social distancing is basically traditional classrooms with some parameters put on cafeteria, large spaces, standing 6 feet apart in line, and so forth. But your classrooms were pretty much, at capacity. So my concern when I saw that, I said, if you give that to the local school superintendents, they're going to choose Plan A to get everybody back in school with the least amount of barriers. So everyone kept on correcting me. They said, no, Mark, this is only if our trajectory continues to stabilize and move in a positive direction. Plan B is moderate social distancing. That's required if the COVID-19 metrics worsen and it's determined that additional restrictions are necessary. And that's when you will have requirements for social distancing and minimal exposure. That would probably be something that you hear talked about a lot, which is maybe 2 days on of face-to-face learning and 2 days off. Everybody distance learning on Fridays, or maybe 3 days on and 2 days off with alternating weeks. Spacing your classrooms out where you have maybe 6 to 10 at capacity in your classrooms. Temperature checks and those types of things. Disinfecting, continuously disinfecting, that's going to be in Plan A as well, but also in Plan B. And then Plan C, which is remote learning only, which is, of course, what we've been on for the last 3 months, implemented, and that's if the metrics continue to worsen significantly and you would suspend in-person instruction. So given those 3 options there, the implementation would actually happen at the local level. So we have 115 different school districts in North Carolina, and we would fear that we would have probably 115 different plans when school comes back into session. Very similar, you all may have had this situation when the pandemic first hit, was that we were all sent home, and then people didn't know if they had to report to work, if they didn't report to work, and who was essential and who wasn't essential, and were we going to get paid and were we not going to get paid, and everybody was doing their own thing until we got some guidance from the State Board of Education. So we do appreciate the work of the State Board that has put forward these 3 different scenarios with guidance that follows the CDC and our Department of Youth and Health, Human Services. Some of the feedback, we did put this out for our members to weigh in on, and one of the things that they said is face masks were encouraged but not required, and most of our educators feel that they should be required, with exceptions for those who have medical conditions and so forth, respiratory impairments that would make it hard, very life-threatening for them to not wear a mask. But that has raised some concern with their members there. But as Megan has said, does give us some clear guidance about what the opening of school will look like. The State Board of Education has moved up our start date a week early to August the 17th. And typically we have work days before that where teachers come and work. Those days have been taken away. They've added 5 additional distance learning days in case school would need to be closed.
Mark, are those kind of like our snow days? You think?
Yeah,
like
we're still all a little unclear about what those distance learning days are like. Yes, it's kind of like a snow day. It is kind of like a snow day, and they're to be used because we add on additional hours to the end of the day, like most school states have done. The 5 days don't put us over our pay contract days, and they're to be used. Actually, teachers can use it's days for students to work remotely if needed be. Teachers can have their remote plans left. They can actually take leave on those days, which is something they couldn't do on typical days. And but it's providing for that window of when we have, if we have to go on distance learning again. But as we continue to watch the metrics and our numbers, the conversation is, are we really going to be back in face-to-face learning when August the 17th comes? That is really just around the corner, as you all know. And so we're trying to have those conversations with our members and our local leaders as we look to as the local school districts create implementation teams. But as you all well know, kids do not social distance. Schools are not made for social distancing. It's very concerning to many of our members, or like myself, are in that last tier to where we could retire in the next few years. And many have, pre-existing health conditions that are going ahead and retiring in order to put themselves in a situation that may put their health at risk. And parents who may just on their own decide not to send their kids back to school. So what we have seen is a spike in our, we have virtual charter schools in North Carolina. Profiteering, they come in, they advertise k12.org. And so they're increasing the enrollment there now, where they get that, $5,000 tuition, state allotment for people funding, and get a laptop and get to be educated at home in a for-profit virtual charter school. So you can believe that the technology giants are going to try to capitalize on all the hard work that we've been doing, all the sacrifices that we've made. But we are having conversations. I was just talking to Megan and George about this. We're talking to superintendents that are very, very concerned about it as well. And guess who they are looking to stir up the ire and insist that schools not go back until it is absolutely safe for us to get into face-to-face learning, and that's their Superintendents and Administrators Association. So we don't know what it's going to look like on the 17th, but when I tell everybody, they ask me what's going to happen, I said we will go back. And Megan knows we're quoting Lily on this, when the health experts say it is safe for us to go back. And this all has to be, you're going to have temperature checks, you're going to have PPE, you're going to have disinfectant. There's no more of using the kind of soured rag to wipe off the goo on the table. Everything has to be disinfected. And, that comes with a lot of money that is now stalled. The HEROES Act, as I know you all are well aware of, is stalled in the Senate right now. And there was a hearing on it yesterday where our state superintendent went and testified for the Republicans. But, and then Becky was there as well. But Becky Pringle, speaking on behalf of the educators and NEA, our money that we received on the first CARES Act is about to run out. So we're going to, how are we going to pay our members and our educators as well if we don't get those resources coming from the federal government, which is, another huge crisis that we're facing. So while not a perfect plan, it is a plan in place that recognizes the guidance from the health experts. Also in 3 different scenarios, going from the most extreme, which is where we are right now, to coming back into school with minimal social distancing, which I doubt will be the case. But if you listen to all the reports, it is just the coronavirus is not leaving anytime soon. It is going to be with us for what we think another year. There's some, hope that a vaccine and some treatment will come out sooner than later. But this may be our new reality for quite some time. But I'll stop there and answer any questions or comments.
I have a question, and then I'm going to go to some of the chat ones. But I know I've heard from some educators here about cutting the unified arts. Cutting music, cutting art, cutting phys ed, because those are the easy things to get rid of.
Yeah.
Not the good things, but they're the easy things. And I know I just got some guidance. I sent the question out to everybody and got some really good guidance from New Jersey that I'm still parsing through. But have you had any conversations about that in North Carolina? Does this seem, I know Massachusetts.
Yeah. Yes, those are the jobs they always want to cut first. The curriculum that keeps kids in school, right? Things that bring us joy, make us happy, the arts, music, physical education, performance. We haven't had those conversations in North Carolina. When the question does come up, we have had our, kind of like you said, your kind of local and state celebrities on these calls. We've had our chairs of the state boards come and talk to us. And when that question is asked, they say, no, there will not be positions cut. North Carolina has been in a chronic teacher shortage crisis for a number of years. We have about 1,500 positions that remain vacant the entire year because they gutted public education, made it so unattractive for new folks to come into. However, I am concerned this was made early, in the pandemic. What happens if we do not get funding for positions, that 3rd grade position that we really need, that school counselor and school nurse? We know that the arts are always looked at first as curriculum that they want to cut. So, that's a situation we may have to look at right now.
Yeah.
And what happens if we do have social distancing? We have 6 kids in a classroom. How is that going to be scheduled, and who's going to teach those kids?
So there were 2 things that came up, and I'm going to go back through the chat too, but one question I can answer pretty easily. What's happened to the care money in New Hampshire? So the governor and commissioner, I'm just going to lump them into one person at this point, have given out about 32 million or so of the 37 million that New Hampshire received to the districts. And they were saving the other portion of it in case Betsy DeVos said that we can give it to the private schools. Because our commissioner really wants to help out the private schools whenever he can. And that was Brinley barking when she heard me say commissioner. I have her trained. Betsy DeVos and commissioner, she barks at. So they're waiting to give some of the money to the private schools. So Bernadette asked what's happened to it. It's been sent to the schools, but I don't know that it's been given out from the schools yet. And it is, it's not all but, it hasn't even been given out to everybody. So this is an issue. 2 issues that came up in New Hampshire, Mark, as really big problems, and there's 2 questions here about it. One of the issues is special ed, and I know that we can't do too much without Betsy DeVos giving the okay, but unfortunately she doesn't seem to think that there's any issues with anything going on, because according to the state, we can still have limited cohorts of 10 people or less, because that's what the CDC recommends, even though we know the reality of it. The other one is, what's the North Carolina plan for remote learning surrounding teachers who have their own children at home? Their district is looking at having us go to our classrooms to teach remotely and providing childcare at a cost, but many of my members are not liking this option because if it's not safe for our students, it's not safe for your children. Interestingly, so that's the first I've heard of that. There's been a concern about what happens if you teach in one district and live in another and you have to go to school, but your kids don't. What's going on in North Carolina with those? Is it the same concerns? I mean,
Yes. We had the last couple of weeks, we had a flurry of complaints into our legal advocacy center about one county said that the teachers and staff would come into school for the remaining last 2 weeks of school. And if you did not have childcare, then you could bring your children with you. And so immediately, they got on the horn, and to the NCAE, we contacted the school district, talked with their attorneys, HR, school board members were unaware of the decision. We were able to stop that decision and make it so that nobody was mandated to come in. They could only come in if they wanted to. Nobody would have to take leave. They would have to burn their leave in order to go on and to stay home on the original plan. And then we also had mandatory graduations and staff reporting to graduations in those scenarios. Again, we would have to intervene, and anything that was held face-to-face would have to follow the CDC guidelines, and that staff, everything with staff attendance would be optional. We did have some schools, most of the graduations were done kind of like virtual, drive-through. A few did like really big football fields spaced out with limited number of family invited. But again, we would have to intervene. We had to intervene to stop some of those really dangerous mandates that were coming down. Special education has been a concern across the country, meeting the needs of our kids and their IEPs and individualized instruction. We've been working with our state Board of Education and the Curriculum Department for Special Education in order to provide resources for our members out there to meet the needs of the kids. The district I live in now, everybody was provided a Chromebook, hotspots, rural areas where school buses provided hotspots, and in certain situations. Again, we were able to somehow get through it for 3 months. What will we do for the next 10 months that are coming up here in August? I mean, we just, the future is unknown on that. We know it's going to be a very bumpy start to the school year, and it's going to be a challenge. This is a challenge to lead in right now, but I can't think of a more important time to be a member of NEA New Hampshire or NCAE and in the NEA family. We have noticed increase in memberships in Wayne County, which is the Goldsboro area of North Carolina, over that issue about making the teachers go into school the last 2 weeks. So the advocacy is really picking up momentum. They're seeing the value on it. We're doing hustle and text messages to keep our members engaged. But nothing replaces face-to-face learning. And so that's, that's the biggest heartache of all. And we think about, in this district alone, we probably have, a couple of thousand homeless children, that are in hotels and homeless shelters and no yard to go out and play in, and what's happening to them. And we're doing our best to meet the nutritional needs. But what a reality check. No school, no food, no meals for our kids, you all. What a revelation to realize. We knew that we were the foundation, the cornerstone of democracy, but now the bedrock of the community has never been more evident here.
In New Hampshire, Mark, we were lucky. Most of our districts actually kept providing the food. So we had amazing people that stepped up. We had, almost all the food service workers still go in and prepare them. We had people going either to bus stops and things like that to get them out or have the parents come in. But at the same time, then they're becoming workers on the front line. And so we actually had some districts that did bargain for hazard pay for them because they were on the front line for it. It's interesting to hear. I do want to ask real quick, there's a question that came up, and I know we have some UDs on here, so I don't know which one wants to answer. 2 questions, actually. One question, and if you're doing anything in it with North Carolina, I'd love to hear. One question is, what are we, let me just get the question, sorry. One was about what do we do with the parents that Tylenol up their kids or Motrin up their kids? Because okay, I've been guilty of it. My kids have had a little slight something in the morning and I'm like, okay, take some Motrin. They'll call me in 5 hours. I'll come get you if you're still sick. I hate that I admit that, but I think we've all done it at some point. To do that now is going to be horrendous because you might be wearing off symptoms. But the question I'm wondering is, hold on. What legal protections are we working to preserve should we become ill after returning to a school facility? And I think there's 2 pieces to this. And I'm going to let one of the UDs, I saw Rachel, I saw Lori, and I think I saw Karen, maybe Michelle. I might have missed somebody. I apologize. One, there's a liability issue with the school. I mean, what happens liability-wise if someone gets sick? My gut's telling me we're working on MOUs for that. But Rachel, I saw you first. If you want to jump in, this is more, you guys are working with the locals on that, so.
Yeah, I can help with that. I think this is where bargaining is going to be incredibly important. It's going to be your best defense against this problem, because we've already heard from the state, from the Attorney General's office, and from the Department of Labor that workers' comp will not cover these situations. So they've done all the analysis, and they already issued a memo saying that workers' comp will not cover your medical bills if you become sick with COVID at work, because in a nutshell, it's not definitely traceable to your work activities. So that, that was our hope, that sometimes the motivation, unfortunately, for our employers out there is the risk or the exposure, no pun intended, that they face if they put their workers in unsafe working conditions and expose them to hazards in the workplace through negligence or nefarious reasons. And so we were really hoping in this case that workers' comp, the threat of workers' comp claims would incentivize our employers out there to do their best job at keeping workers safe from the virus. But that's not going to be the case according to the state. So I think you're really going to have to bargain hard with your school districts for all the protections that you deserve and that you want to make sure that you're as safe as possible. And that you bargain with your school districts and with, we have folks from Keene State here as well. So we're bargaining with the system for, with the university system for protections for employees and also for expanded leave, for leave that's not punitive, that somebody already mentioned earlier, that leave that doesn't eat up your accrued time. That's a special form of leave that's available for this purpose to keep everybody as safe as possible. We don't know yet what's going to be available from the state and local government in terms of the special kinds of leave that were available in the spring through the CARES Act and other expanded leave programs that were available. We don't know if those are going to continue through the end of the summer and into the fall. So I think your best hope is to work directly with your employers to bargain now for those protections.
So MOUs and things can be put into place, right? If you can bargain those, the memorandums of understanding for that. Do you think this is something, I mean, Brian and I are in touch pretty regularly with our US delegation. And I was just on a labor call yesterday with Congresswoman Custer and Congressman Pappas. Do you think these are things we should be bringing to them? Because they're always wanting to know what we're looking at federally and how we can help. And it's a lot of funding, things like that. I mean, I'm more than happy to talk to them tomorrow about getting some of these workers' protections in for COVID. Okay, that's a yes. Okay. The other thing I just thought of with this, and I don't know why I didn't think about it before, but we had such a fight last year and the year before on school violence. And at the time we were looking a lot at, the hitting, the kicking, the biting, the spitting. How is this going to fit in? If we go back to school in the fall and we have kids who start coughing on educators or spitting on them, taking off their mask, doing whatever, what is that going to look like? I mean, can we trace that back? I'm literally, this just came to my mind and I could be completely off on this, but I mean, can we consider that almost the same abuse or violence against educators if we think they might have COVID and they come back and have it?
Are you asking me?
Anyone? I don't know. I don't know.
I mean, all of the behaviors that you just talked about are considered assault, technically.
Right.
Legal advice. I'm a UNISERV director. I'm not acting as a lawyer, but you can look up the definition.
Not your lawyer glasses. Come on.
Spitting counts. I'm trying to look like a lawyer. But. So, intentionally coughing on someone to, even as a joke, to make them fearful that you are communicating a disease to them, in my opinion, would be considered a battery or an assault.
I just wonder what we can do. I mean, we're going to have, I taught in middle school for 18 years, and I know there's teachers from all over, and we saw the violence went down as young as kindergarten. I'm just thinking this could be a real potential liability.
What some of my locals are doing is they are making sure that everyone, every single employee gets trained in behavior management for students, because they're expecting that when students return, they'll be particularly dysregulated because they have been out of school and now, there's been this trauma to them and there's been all this transition, which is hard. It's like when they come back from April vacation, they're dysregulated because they've been out of school and they're coming back, and that transition is tough. And imagine, multiply that by 1,000.
Right.
So they are making sure that everyone gets trained in that kind of de-escalation and behavior management. And also some of my locals are bargaining for hazard pay, specifically in critical behavior programs. So for instance, in Keene, they're going to be bargaining for hazard pay for the paraprofessionals and other employees that work in the pull-out programs that are specifically for behaviorally challenged students, because they're anticipating that, the spitting is going to take on a different kind of a threat to their health. And they're going to need special protective equipment. They're going to need access to leave. They might need increased staffing to be able to help manage those behaviors and keep everybody safe. So they're working on that now.
Yeah, interesting. And someone just wrote in, Jan just wrote in, can't remember clearly, there was some legal action done when AIDS first was identified. So that's probably something definitely to look back at and see what the wording and everything was to see what was going on. There was another one asking about North Carolina.
I'm getting up close here.
I know, sorry. Where did it go? So I will talk to the delegations tomorrow. It was, where did it go? It was something with, and I can't find it right now, but something with what is North Carolina doing oh, here we go. Is North Carolina making plans for special ed students who are medically fragile or have medically fragile family members? So do you know of plans that are being made, I think, for like those kids having to stay home and be taught?
Yes, there are. I know that there's been several virtual meetings and work sites addressing that from the state level, from North Carolina. That's a great concern, obviously for our medical fragile students that have a huge need and special assistance. And I know some educators have been going to the homes as well to meet the needs of their students there. But that's one special population that we are really concerned about right now, in conjunction with our homeless students. And just to think of what's, when we do, just the amount of lost learning and support for our kids right now. And Rachel talked about the behavior regulation that's going to have to be, we're going to be we're traumatized, we're going to try, whenever we come back into what is going to be somewhat of a normal or semi-normal work environment, what is that going to, to be? So there's going to have to be a lot of support there for all of us, as this continues to drag on until we're able to get out again. And it's just that unknown right now. But clearly I was glad to hear you all say that you all did have some hazard pay in some of your local districts for being able to bargain. We were able to get that for our ESPs and essential workers that were, and several of them got sick, and got exposed to COVID at the early onset of food distribution. We also are on the midst, we still haven't passed a state budget for the General Assembly that is back in session now. So we're in I don't know how you all are in salary and raises for your folks. We haven't had a raise really in 10 years in North Carolina. And the governor was fighting for one this year, but of course our Republican-controlled General Assembly was not having any of it. So, they're back in session now, and we're trying to get additional dollars for all of our public school employees and raises right now, and it's a challenge. And of course, they want to come back with us. It's like, you talking about people aren't working and losing their jobs and unemployed, and you're all wanting a raise. And we're talking about, listen, I said, our folks haven't really had significant salary increases since the recession. We took the hit of the 2008 recession, public education and our students did, and we did, and we can't do it this time, particularly when we had the largest tax breaks in recent memory for corporations, that and probably an ensuing recession here. So we don't know what the budget situation is like.
Well, so our governor vetoed the budget last year that was going to give an extra $138 million to education. In New Hampshire, it basically comes from property tax because we don't have income or sales tax. So pretty much everything comes from that. The state gives an adequacy grant of 36 or so hundred to each student in New Hampshire, or to each district. But then the rest of it, we know it costs on average $15,000 to educate a student in New Hampshire. So the rest of the money has to be made up in property taxes. So we have property rich towns, we have property poor towns. I mean, they're all over the place. And in many of the districts, it still goes back to the town hall meeting where you're sitting there begging for, your contract to be passed, and people in the town, we didn't get a raise last year. Why should you? And we're never not political in New Hampshire. The UDs typically all have about, I'd say on average, at least 12 contracts a year that they're bargaining. So it's always going here. There was a couple comments that I just wanted to mention. Someone had mentioned, a lot of the training on the social and emotional learning and the needs that are going to come up. Mark doesn't know this, but 5 of the 6 New England states, New Hampshire, Vermont, and Maine, and Mark, you can't take this because we got it first, so you can get on our tail feathers about this.
Okay.
But Maine, New Hampshire, Vermont, Connecticut, and Rhode Island, we just got a $50,000 grant from NEA to start communication on a 3-year plan that we're hoping to get $750,000 from NEA for. And it's all on social and emotional needs. It's all on trauma. And with everything happening, we're connecting everything right now. And so I was just on a call with the other presidents this morning, and we're connecting with Yale, we're connecting with Castle, and there's a couple other folks that some of the people knew that we're going to have webinars and things like that mid-July this summer, starting on self-care for educators, but not just meditation and reflection. It's really true self-care for educators going back and how to deal with that. We talked a couple weeks ago about the educator guilt and how you deal with the guilt of trying to deal with your home life and your work life. And so we're going to have it on that. We're going to have it on dealing with students. We're looking at tying in adoption folks and foster home people, because that's a population. Homelessness, that's another population that definitely has some other significant needs. And so that's something that we're going to be working on, the 5 states. The only reason Massachusetts isn't invited because they never wanted to be part of it. So it's all, it's the other 5 states that are part of it. So we're working on that. And when we get it right, Mark, then you guys in North Carolina can
send it down our way. I could say again, another big shout out to the great work NEA does, his support, our state affiliate.
I think it's going to be really good, and so that I'm hoping can answer one of the questions that somebody had about that. So please keep a lookout, because we're going to be, and then we're going into like a train the trainer type thing, so that we can go around the states. But there was one question that I wanted the UDs to answer: legal liability to staff who go to student homes. Our district did not allow this for that reason. I don't know if Rachel or Lori or Michelle or anyone else wanted to pipe in on that question. I didn't want to get into the legal liability piece of it.
Do not go to students' homes under any circumstances. That's our standard advice. Don't do it, because you can't control the environment, and it involves travel, which exposes the district to some liability for you as an employee. But also, you are all mandatory reporters. And so whatever you see in the home, you're required to report. You don't want to put yourself in a situation where you're seeing things or observing things in the home that you then have to take steps to address. And when you are not in your workplace, when you're working outside of your regular workplace, there are so many uncontrollable factors in the environment that you're working in that not the least of which is that there's not another colleague necessarily with you to observe what's going on and to be a witness to make sure that everyone is acting appropriately. So, and it concerns us, especially if you're going into students' homes. Well, you should never go into students' homes. But if you're having that kind of a more social interaction with students, or an interaction that they perceive as social, they don't necessarily understand that if you're in their home, or even when you're Zooming into their home, that this is your workplace and you're at work doing your professional responsibilities. They may perceive it, or they're more likely to perceive it as a more social interaction and experience those boundary confusions and boundary issues that, that is a road to nowhere that you want to go. And so, those are just some of the reasons that we plead with members not to go into students' homes. Under circumstances where you needed to meet with a student to do your professional work outside of the school for some reason, like if the student was ill, or we've had some students that because they got injured and they couldn't come into work, they needed a tutor to come into their home. make sure that the expectations with the family and with the students are really clear, that that's your professional work and it's not a social visit. But we strongly discourage it. And there is some liability to the district as well if, like I say, if you get injured or if you're exposed to, if you're asthmatic and you get exposed to cigarette smoke or other environmental factors in another place that your employer can't control, then it opens the door to lots of different problems. So your district made the right decision in prohibiting you from doing that.
Rachel, could you just address for us, talking about safety, and I don't know if everyone knows what the joint loss management committees are, but could you just talk a little bit about that? All the unions are legally entitled to appoint members to those committees.
Yeah.
The committee can demand safety, health protocols. I mean, could you just touch on that a little bit?
Yep. So joint loss management committees sometimes are referred to as safety committees for short, because joint loss management is like a nonsense phrase, but that's what they're called in the statute. They are required by law for every employer to have a joint loss management committee. And that committee is according to the Labor Department regulations and state law, are supposed to be made up of a balance of management representatives and employee representatives. And if the employees are represented by a union, then the union is entitled to appoint those committee members. And they're supposed to be composed of a variety of employees that represent the different classifications in that workplace. So if you have custodians and paraprofessionals and teachers and administrative assistants and administrators, then all of those employee classifications should be represented proportionally on the joint loss management committee. That's how the state regulations are written. And the committee is supposed to address safety concerns and concerns about health hazards in the workplace. They're required to meet at least 4 times a year, and they're required to make their minutes available to all employees to inspect. And they're also required, if any employee brings a safety or a health concern to the committee, management is required to address it and explain what they're going to do about it. And they have to either explain it in writing or explain it to the committee to be memorialized in the minutes that are available to all employees. I think this is underutilized in our schools. Not only is it legally required, but it's very useful as a voice for employees to be able to express their concerns, and they're legally required to be addressed one way or another. They're also supposed to do inspections of the physical plant, but that's not really relevant to your question, which is more about spreading diseases. Although actually it could be, now that I say that, because if there are demands in your physical plant that need to be, parts of it that need to be changed in order to accommodate physical distancing between people, in order to, upgrade the HVAC, for instance, to make sure that the air quality is healthy. Those are all things that the Joint Loss Management Committee should be looking at.
So Lisa just asked this, and I was actually just going to ask the same thing, Rachel. Is this something that we can put together, just what you basically just said, to put on our COVID? There you go. Karen just sent it to us. Thank you, Karen. You were quicker than I was. Can we get that on our COVID page for everybody so that people can, George, can we get that link posted so people can go to it if they're not on the site tonight?
Sure can.
Thank you. The other thing that oh my goodness, hold on, give me a second. I just lost my train of thought. I was going to ask you the same question, but I just lost my train of thought. I had another question on that. So thank you, Karen. We'll get that put up on there. It was something that you were just talking about with the Joint Loss Committee, legal minutes. I don't know. It'll come back to me. I'm getting old. It's one of those days.
Yeah. Don't say that. Just getting better.
So I'm going to go through, because there were some other kind of general things on here that I know I needed to follow up with, but did anybody, unmute yourself, ask questions right in the chat box. We have a wealth of knowledge on the call tonight between the UDs, between, what's going on in North Carolina, between all of you here as leaders. This is what we have. So
Sharing my condolences.
Who's that? Did someone? Did I hear something? I can't see. I have 3 pages of things. 3 pages of,
No, you're good.
okay. I don't know if anyone had any other questions, or, I mean, this is something, you know, like I said in the beginning, it's going to be really interesting to see what happens with this task force. Recommendations are going to be going before our governor and our commissioner soon. They did look at the North Carolina plan, and, you know, we'll see what happens. I don't know at this point, unfortunately. As I've said on almost every call, we are going to be the 800-pound gorilla, just because we need to be, and the safety of our members and our students are going to come first. How are we accommodating the students immune compromised and family members? That's, you know, Beth, I wish I had a direct answer tonight, but that's something we're all working on. I think next week, I don't know of a time yet that districts have to decide their plan. I think what they're doing is they're waiting for the commissioner to come out with something, even though districts don't have to follow it or mandate. But I don't know, you know, which is why I think we need to be on all of the committees and everything now to do it. Next week, I think a lot of these questions, so Jan just said, I heard some districts are telling older staff that they cannot come back. That's not really allowed, right? You help me out here, but I'm just gonna go out on a limb here and say that's not really allowed. So Jan, we might want to talk about that. You might need to get a hold of your UD, or let me know where you're hearing that, because yeah, that's not allowed. That's pretty concerning.
Hey, Megan.
Yeah.
So I was wondering, where does that line get drawn between what our district says is management's right to have us do things versus what's we can bargain for? I think that's a question that's going to come up a lot as we move forward.
Who wants to tackle that one? Rachel, Lori, Michelle, Karen, who wants to?
Talk to your UD, because it could be fact specific. So your UD will be able to advise you about how to approach that situation. Management often will just, as a blanket statement, say, oh, it's management right, we can direct the workforce to do whatever we want, and you don't have anything to say about it. But it's more complicated than that. So there are some subtleties and some ins and outs to what's required to be bargained, what's prohibited from being bargained, and what's in the middle, what's permissive. So talk to your UD about the specific issue that you want to bargain over, and they'll know what to do.
I think next week I would plan on a little bit longer meeting, if you guys don't mind, a Tuttle talk. We're going to take a break the week after because it's the week of July 4th, and we still have the representative assembly, even though it's virtual this year. I'm still working on that, Lisa. I see your head nodding, and Tara, I think there's, you know, that's like, honestly, I hate to say it, that is the last thing on my mind right now. And the fact that it's virtual this year, I'm not going away for 10 days. I think I kind of forgot about it. But next week, I would plan on, well, we didn't go last year, right? I mean, we boycotted Texas and nobody followed our lead. I think we should have boycotted this year. Unfortunately,
I forgot about your boycott last year. That's right, you did.
We stood on our morals.
That's
and then,
right.
you know, 20 seats from New Hampshire, no one even knew they were missing. That's okay. We knew what we were doing. This NEA guidance to state local associations on reopening schools, colleges, universities for in-person instruction. It came from the Office of General Counsel and the NEA Collective Bargaining and Member Advocacy Department. This, I think, is going to be a really fun discussion. I actually think it's going to be fun, if that tells you anything, how my days have gone with me and my dog. But I think it's going to be a really good conversation. Donna Harris-Aikens, a senior policy person from NEA, is going to be with us, and I'll see if anyone else is going to be there. I will get this out somehow. This is an internal document, so it's really for NEA members. So you guys, your locals, your leaders, just not to share with supers or anything like that, because it does talk about safe and healthy school operations, contingency plans, communication plans, addressing wages, hours, other terms of conditions and employment. So all these things are in there that we don't want to be. Yes, I will get it out ahead of time, Gail. I will, and having a meeting with Lisa. I'll be in touch with that. I think I probably will hopefully have some sort of president's meeting as well, but I do want to open it up to anybody who wants to talk about it. But I do think we'll be able to kind of narrow it down, and maybe we can even go different weeks after that into some of the more interesting topics that people are wondering about. And that's where, the UDs are going to be vital to this. So I'm hoping they're going to be on next week as well. So we will get it out. We're going to actually, hopefully by tomorrow, we will get some of this out. And when you maybe register for the link, we'll get that out. Seems teachers and members are not well suited for these conversations, or lawyers. What do you mean by that, Jen? Where'd she go?
Sorry.
Okay.
Yeah, I'm concerned that our union members
Mm-hmm.
are being put in a situation that they're not trained in. We don't have the language for, we don't have the experience to be in. This is kind of a unique situation. This isn't your typical bargaining.
Yeah.
And I lack a lot of confidence in my association's ability to bargain in this situation. So I just think that, if everyone's looking to the NEA for guidance, that's great. But I'd like to know that the NEA is going to provide districts with the resources so that we can actually have kind of an educated voice, because I don't feel like we're going to be going to the table and having an educated voice. And I feel like we're being run over and we're not being treated fairly. I understand, we need to prioritize kids, and kids are important, but what about teachers, right? What about my safety? What about my health?
Yeah.
What about the health of my family? And I'd like to see, lawyers at that table and not the English teacher from the middle school.
Yeah, no, that's a great concern. And I'm seeing a lot of head knocks and yes, and like Marianne just said, we don't know what we don't know. This is really where your UDs come to play. It really does. The UDs, you should be reaching out to them, and they are the ones that have the expertise in this and the language. And I'm going to let them answer that a little bit for you, but I know that, they're on bi-weekly calls with trainings as well. We have a truly amazing staff at NEA New Hampshire. We really do. The background that most of our UDs have, we have, I don't know how many lawyers on staff that aren't working in a lawyer position, but they are lawyers in past lives or went to law school, or just through bargaining and advocacy. The knowledge that our UDs have, I do like to say we hire the best people we can, and they have the expertise on this. So from my point of view, anything you need, you go to them, and they're going to be there to help you. I'm going to let them.
And if I can cut in for a moment, no doubt, Jason is our UD, and our association president has been in contact with him, and we've asked. What's that?
Are you Goffstown?
Yes.
Okay.
Yep. And so, we've asked the SAU to be part of those conversations, and I just feel we're playing very nice in the sandbox, and I don't think that's where we need to be right now. Yeah. So I know that there's a lot of knowledge and experience on the NEA side. I just worry that it's going to turn into a game of telephone with the association and the UD. And, I want to, just to be realistic, I feel like because so many districts are drawing on this resource right now, I don't know how you split that up time-wise. Rachel, everyone that's on this call, it's a UD, you're probably strapped right now because everybody's beating down your door. Like, I don't know if you can physically be at the table so that, our members aren't going to into these conversations trying to recall the specific language that was dropped to them on phone conversations,
Yeah, we appreciate your concern, but we can do it. We are prepared. Okay. And we can't physically be with you at the table because we're doing everything virtually right now. I know that's probably not what you meant when you said physically be at the table with you, but
yeah.
But in fact, that actually does help us in terms of scheduling, because it eliminates the travel time that we ordinarily would consume part of our workday if we needed to travel from local to physically be with you at the table.
Yeah.
So we're prepared for a heavy workload this summer and fall, with the recognition that every single one of our 230 whatever locals probably will be negotiating all at the same time, and we're prepared to do that.
Well, I
There's no reason
appreciate that.
any local that wants their UD with them participating, drafting proposals, you don't have to do it alone. This is our day job. This is what we're here for.
Yeah.
So we're ready to help. And a lot of our locals are actually collaborating together and brainstorming sample language and templates, and the UDs are working on some templates as well, so that every local doesn't have to reinvent the wheel. Obviously, it's going to be tailored and negotiated to be specific to your local's needs, but we are working in collaboration as a staff and as our regions and as a state to come up with some common ideas and some common sample language that you can draw from and work from those templates. So I've been very busy behind the scenes working on those templates, because we know that, you know, you've got a focus group or a task force or a committee or some amalgamation of stakeholders who are coming up with ideas about what to do in the fall, but that's not a substitute for bargaining. So to the extent that any of those plans or ideas affect your working conditions or your terms of employment, then, you know, including your safety, including maybe some compensation, including your schedule, your work hours, your work days, your calendar, your physical workspace, all of that is negotiable. And so all of that is going to have to be sorted out with the union, and the UDs are prepared to help you with that.
Well, I appreciate that clarity. It's definitely a frustrating situation to be in, and I don't know if other districts are kind of ahead of the game like we are, but it almost makes it worse because we haven't been part of the conversation of conceptualizing this. So it's like cooking dinner and for somebody and then them critiquing it after the dinner's already over, like, well, you can't change it now, you know, like it's already done, which I know we can, but you know, but I appreciate all the clarity. Thank you.
And I would talk to your UD. I don't want to monopolize the group's time here, but talk to your UD about that very directly and say, here's the pushback or the feedback that we're getting from our employer. Maybe they're ignoring us, maybe they're not taking this seriously, or maybe they're saying it's too soon to be negotiating, but really now is the time to be making those demands to bargain, and make it clear with your employer that they should not be implementing any of these changes that they're brainstorming with the stakeholders groups without bargaining with the union. And it's the union that gets to decide. It's the union that's legally entitled to decide whether there is an impact on terms and conditions of employment. Don't let your employer tell you that really doesn't affect your terms and conditions of employment. You're not entitled to bargain over that. That is not their call. Union gets to make those decisions about what they want to bargain over.
Thank you.
Welcome.
Thanks, Rachel. You very, very eloquently spoke exactly what, you know, you guys do every day for the members. So thank you very much for that. Real quick before we go, there was a question from Gail. Hopkinton, I don't know if you know this, let go all their ESP. All the ESP were let go at the end of the year because of the budget vote and everything that happened. So there is a letter writing campaign that just kicked off, and George, I have the text on it. Jason wrote, we're live with a letter writing site for Hopkinton support staff. Tell your friends. Can we post that for people to write if they want? Or if you or Lori want to, I think Lori was in on the plan for a little bit, if one of you wants to mention what's going on with that.
I posted the link. And if Lori wants to talk more about the details, that's fantastic.
Lori?
So George, I'm not as aware of the details as you might be.
Okay, no problem.
I think
I do know that this is an important issue, but I thought the meeting was tonight or tomorrow night.
Okay.
And so I'm just not sure which night. But I also think that the important part is for community members to write to their school board.
Right.
So if you don't live in Hopkinton, it's probably not important for you to write to them.
Okay.
Right. It does. It's a letter writing campaign that Action Network we're using to send it out. It does ask for your address before
If you
you.
have friends in Hopkinton or know
Right.
people that live there, it's not a good situation that happened there. And this is something, you know, the letters are gonna, I think, be speaking to what they do, the importance, you know, how crucial ESP are and vital, how they are to the schools. Because essentially this could happen to almost any district if you think about it in New Hampshire. So we have that, but Gail, we can always be in touch if you want to get in touch with me offline. We can talk a little bit more about it.
And that's not the only thing that's going on, right? They've made some flyers. They're going to be at the transfer stations.
Right.
They're doing all the typical New Hampshire, you know, get out the vote activity that they can. But the new thing is a letter writing campaign that kicked off tonight.
So I don't know if that,
I was just following it closely because I do think we're going to see more of it happen if we go remote in the fall.
Yeah.
And to protect, I mean, that's 80 people. Some districts have a couple of hundred, some have less, but no matter how you look at it, it was devastating, I'm sure, to the families. And if I were them, I wouldn't come back if they asked me to.
Yeah.
I'd be so pissed. But at the same time, you don't want to lose your job either. So I'm following that one closely. So
yeah.
something I
It's
can
all-
do outside of Hopkinton, let me know. I don't live there.
Okay, it's all part of the Educate and Elevate campaign too. That
Yeah.
you know, I mean, you're on the ESP issues committee, and that's all something that you know, we're using this kind of to elevate to the public and educate them what ESP are doing.
Yeah.
And Karen said that PTO has lawn signs, so I'm hoping, Karen, that they're in our favor for the ESP. I hope they're not the other way. So yeah, I mean, this, you know, like somebody said, you know, it's good in one way to know that what we're going through in New Hampshire is happening in other states. It's not good that it's happening at all, but you know, it is happening. And I think something that we need to just keep in mind as we go through this is, you know, NEA really does support each other. The states are in touch. We know what's going on. Everything we do is going to be specific to New Hampshire, but just being able to reach out to other states and hearing what's going on and knowing that, you know, we're not alone in this. Definitely is helping as we kind of make our way through this. We're not Vermont, where the governor went ahead and said schools were reopening without really talking to Vermont NEA too much about it. And now they're trying to scramble to figure it all out. So, you know, this is something that we are working nationally together. You can check out the Hopkinton PTA Facebook page for signs. Thank you. And so, yeah, I mean, we're going to get through this. We will be that 800-pound gorilla. I will be wearing the costume at some point, no problem. And very excited about that. Can't wait. Next week, like I said, maybe plan on a little bit longer. Pour yourself an extra glass of whatever beverage you're drinking, because I think it's going to be an interesting conversation. And it's going to be a good one. I mean, this one I think is going to be, you know, a lot of the meat about what we're doing. So we will get the link to that guidance sent to you when you register. And I do want to get that out tomorrow or Friday at the latest so we can start registering, because I think it'll be a big one. And yeah, that's, you know, thank you, Mark, for joining us tonight. I love getting other people in here, especially someone who can talk as much as me.
I love being a part of the New Hampshire family. You all were great, and to learn, you know, we are in this together. There are so many commonalities, so many unknowns, but it's reassurance that our NEA family ties us all together. So great to be with you all. Thank you.
You're welcome. So thank you. And thank you, everybody. Have a great night. Of course, after I fed my dog about 20 pounds of doggy treats, she's passed out cold. So that's fun. But thank you so much. And I will see you guys next week. And have a great night. Thanks, everybody.
Bye, everybody.
Bye. Thanks.